Hello, Edutainment Studios and Access Healthcare welcomes you to Adult Vaccines, Living and Staying Healthy. This course material was co-written by Brady Lay, corporate trainer, teacher, and Linda Diltz-Benson, RN, Director of Education. Today, we will be discussing vaccines for adults. This module is part 3 of a 5-part series on adult vaccines. This series is intended to help you better understand why getting vaccines as an adult is important to your health and what you can do to ensure that you are protected. As we get older, vaccines help us to be more healthy. Knowing more about what vaccines are, what they do, and which ones you need will help you feel so much better about getting them. In this module, we will be looking at the vaccines that are recommended that you get by the CDC and FDA. On the next few slides, you will see a list of vaccines that are recommended by the CDC for adults ages 19 and up. You should talk to your doctor to find out which vaccines you need and when you should get them. The general recommendations are influenza. 1 shot every year because the flu virus changes. It is best to get in the early fall around September or October. TD, Tdap, you get 1 Tdap and then TD booster every 10 years. Varicella, 2 doses, only if you didn't have chickenpox as a child. HPV for women, 3 doses, if you are 26 or younger and have talked to your doctor. HPV for men, 3 doses, if you are 26 or younger and have talked to your doctor. Zoster for shingles, 1 dose for 60 years of age and up. MMR, 1 or 2 doses, depending on the indication. This combination is needed if you were born in 1957 or after. PCV13, 1 dose for those age 65 or older if you didn't receive it at a younger age. PPSV23, 1 or 2 doses depending on the indication, for ages 65 and older and at least 12 months after getting PCV13. Other vaccines that your doctor may recommend include hepatitis A, hepatitis B, meningococcal, and Haemophilus influenza type B, depending on your risk and other health conditions. Your risk of getting certain diseases and related complications increase if you have a chronic health condition. This may mean that you need additional vaccines. These chronic health conditions include diabetes, which makes it harder for your immune system to fight off infections. This could put you at risk of serious complications if you get an infection like hepatitis B, flu, and/or pneumonia. Heart disease also makes it harder for your immune system to fight off infections and puts you at risk of serious complications if contracted. Some conditions, like the flu, can increase your risk of heart attack. COPD and asthma increase your risk of complications from the flu and other diseases that cause your airways to swell. If you have another chronic health condition or are pregnant, ask your doctor which vaccines you need and if there are any that are not safe for you. Please feel free to investigate these other sites for more information, and remember to bring any concerns or questions in to discuss with your doctor. Thank you for joining us today for part 3 of this 5-part course on vaccines. Please let us know how we did by completing the survey that follows. If you have any suggestions or questions, please send them via the survey and come back for part 4.